Well, thank you for joining us. I greatly appreciate it. My name is Jenny Overly with Unidine. I'm a Director of Nutrition, Health, and Wellness, along with Catherine Lynn, who's also a certified dementia practitioner, and this is Todd Saylor, a Director of Culinary. So we're going to talk a little bit about fresh bites and memory care. I'm sure both professionally and personally you may know somebody that has dementia and really have seen the impact that it can make. It's a progressive disease with no cure. The statistics are staggering. Currently, 1 in 9 adults have dementia, and the risk for dementia increases with age, starting at age 65. So as we just naturally age, it's unfortunate the risk for developing dementia continues to increase. By 2050, we will actually double the population that has been diagnosed with dementia. For us, really looking at food and nutrition and how best we can serve individuals nutritiously, as well as providing them a great dining experience, we know that dining really can be impactful to the disease. Those with dementia, unfortunately, now really no longer enjoy eating. They may not even remember to eat. They may not know that they just had lunch and that dinner is soon approaching. The impact to decreasing taste, smell, and even sight impacts their ability to really enjoy the meal and to consume enough calories. Many individuals now no longer can even use utensils, and they frequently pace. It's unfortunate, as we know, if we don't take in enough calories and nutrition, weight loss is bound to occur. But with dementia, it's an interesting process because the disease itself, just through the progression of disease, unplanned weight loss can occur. But if a person has a significant weight loss, that can actually exacerbate that disease progression, and the cycle becomes very difficult to slow down and very difficult to reverse. What we're seeing in the industry, though, for those that are in the institutionalized settings, it's really unfortunate because their response to a memory care program is very minimal. What I think about their finger food program, to me, looks like a toddler's menu. Finger foods, chicken fingers, sandwiches, tater tots. One, it's really not even appealing probably to that generation, and two, we know it's not nutritionally adequate. And from there, the heavy reliance on commercial supplements. And finally, instead of helping those that can still use that natural hand-to-mouth reflex, staff start to take over to feed that individual. Our response is very different, and that's what I love about Unidine. We really look at everything as a fresh thinking, a new approach. And we always start first and foremost when we look at our challenges to see it from the resident's perspective and in the resident's eyes. What really will help them increase their nutritional intake to hopefully slow the progression in the disease. Committed to a fresh food pledge, we start with our ingredients first. We rely heavily on our expertise of our chefs, and of course we look at the whole dining atmosphere from the ambiance and what the tabletop should look like, to look at the whole package to address the whole individual. As a dietitian, we are committed to the science that's behind the ingredients. We've had great fortune being in Boston, working with Tufts Human Nutrition Resource Center and collaborating with Dr. Sendler and learning more about the ingredients that can help to protect the brain. We have a great sampling of ingredients here on display as well. Some of the items that Dr. Sendler is currently researching is green tea, turmeric, our cruciferous vegetables of broccoli, cauliflower, Brussels sprouts, and how they can actually help to not only delay the cell degradation, but also hopefully helping to regenerate some of those damaged cells. Some of the other compounds that we have in our food naturally occurring are omega-3 fatty acids, as well as the antioxidants found in chocolate, which is our favorite, of course, but also coffee and our lentils and a variety of fresh fruits and vegetables. But the challenge to me really comes in. We can understand the science, but how do we translate this in food that our residents with dementia would really want to consume. And that's where we look to the expertise of our chefs. And so when we sat down to work on recipes and really develop the program further, we looked at the idea of vessels. And I know for many of you, you might think of a vessel as a glass, a cup, a ship even, but we looked at it as a vehicle, a way to consume enough calories and nutrition in bites. And so this way a resident can simply pick up any of the items. Potatoes may be filled with a variety of items. It could be eggs in the morning, it could be a little bit of meatloaf or other mixtures, and be able to provide them that easy reflex of hand to mouth in bite-sized portions. So this is our idea around vessels. And as you can see, this is really a small sampling of the ideas that our chefs have come up with. And we constantly are looking at new ways to be able to create things like lasagna. We wouldn't typically think that lasagna could be a finger food, but using the phyllo dough to wrap those key ingredients and those flavors really still helps to deliver something that people loved, lasagna. The other piece of our program, again, is really looking at the overall dining atmosphere. What atmosphere is the best for those individuals with dementia? Focusing on color, focusing on the color of the plate, and what does that tabletop look like, so we can help draw their eyes in and help engage them in their meal, as well as training. And that's why we invested our time and energy in having some of our key team members trained as certified dementia practitioners, because it's about how we serve people. And so our dining service aides need to understand dementia and how to approach someone and utilize visual menus versus a written menu that someone may not even understand anymore or be able to elicit a response. And in developing our program, we really look to our clients. We have some great clients who are also passionate about memory care, and we approached 6 clients and asked them if we could test and pilot our program at their facility. And that's really how we were able to come up with a variety of vessels, all the recipes that were needed to support the program, the training, and then looking again at that dining atmosphere. And we've had great results from our clients, great feedback, so that we know that we've now created a program, again, starting from the customer's viewpoint and building it back to what do we really need to execute that. So Fresh Bites for Unidine, it's a hands-on approach to memory care dining. It's our way to not only nourish the individual, but to nourish their mind and their spirit.